Before your surgery, your doctor will first take photographs of the area to be operated on and may do any markings that are necessary. He'll also discuss the means of anesthesia. Now, we have several choices for anesthesia. First of all, there's local anesthesia. In that situation, the area is simply numbed up with a series of injections. You won't feel anything after those numbing shots are made, but you will be completely aware during the procedure, just as if the dentist was working on a tooth. For many people, local anesthesia is still quite too scary, and they prefer some form of either IV sedation or even general anesthesia. IV sedation is performed by placing a cannula through a needle inside of one of your veins. Then you won't need any more injections for the doctor to give you additional medicines. Most of the time, once IV sedation is applied, you won't remember anything after that happens. You may remember some little tidbits about the procedure if you only use IV sedation, but you'll be way too sleepy and the area will typically be numbed up and you'll still enjoy a good experience with that. If the doctor is concerned and wants to have complete control of your motion and needs to make sure that you're motionless and completely asleep during all instances of the procedure, then he may prefer or recommend that you have general anesthesia. Again, you'll be put to sleep with an intravenous cannula and drugs sent through the intravenous line, but after that, a tube will be placed down into your airway and gas anesthesia will be administered. This will make sure that you are 100% complete and motionless during the procedure. When I'm performing nose surgery, we tend to give patients intravenous anesthesia, and that tends to be our first choice. Intravenous anesthesia is also known as twilight sleep. During twilight sleep, you may remember some little flashes at the end, and you may be even somewhat responsive to the people in the operating room. But rarely will you remember anything or afterwards even know that you had the experience. General anesthesia has the disadvantage in that many of the drugs may take longer to clear out of your system, and sometimes your recovery may be a little prolonged through general anesthesia. Also, having a tube down in your airway can be an irritating effect that some doctors like to avoid if it's not absolutely necessary. After you've been sedated or put to sleep, we will make injections around the nose area to make sure the area is all numb. In addition, with nose surgery, we're putting in decongestants into the nose to shrink down the blood vessels. With nose surgery, there are several main parts of the nose that we're working on. There is the bridge of the nose, the tip of the nose, and the base of the nose. Those are the main cosmetic regions, and you want to discuss each of those with the doctor before the surgery. Also, if you have breathing problems or airway problems, or your nose is crooked or has been fractured before, you'll want to make sure your doctor is an expert on working on the inside of the nose. The structure involved there, the most important structure, is the septum. And perhaps you've heard the term deviated septum. And that means that the cartilage that separates the nose into two passages is crooked to one side and tends to block that side. During your surgery, you'll want to make sure that your surgeon fixes your deviated septum if that's causing you breathing problems. And you'll want to make sure that you have a surgeon who has the experience and knowledge to fix that area of the body. Also, contributing to airway problems may be the turbinate tissues on the sides of the nose, and some patients even have sinus problems that also need to be corrected during surgery as well. Returning back to the cosmetic issues, again, we talked about the bridge, the tip, and the base of the nose. Typically, the bridge is either extending out too far and someone wants their bridge made smaller, or the bridge is collapsed or curved inward and someone wants their bridge made higher. Sometimes the bridge is crooked and simply needs to be straightened even though the height is adequate. The tip of the nose typically is made smaller. People want what's considered a more refined tip. The base of the nose often is considered too wide for most people's aesthetic taste and needs to be reduced. Sometimes it's simply too wide as compared to the other components of the nose. Plastic surgery is often performed to achieve a natural balance between not only the features of the face, but within the face, create a nice balance within the structures that are being operated on. And so when we're performing nose surgery, we want to get an aesthetic balance between the bridge and the tip and the base.